afternoon, everyone. Thank you for joining us for our latest Earthenar. I'd like to introduce you first to James Nolan, who's the Associate Director of our Community Engagement Core and is also one of the co-leaders of our Reach the Decisionmakers program. James?
Good afternoon, all. Thanks so much for being here. This is our second installation of the Reach the Decisionmakers summer series. We're really excited to hear from our team today. They'll be talking about protecting public health from rising coastal groundwater through their project Improving Policies to Account for Migrating VOCs in the Richmond Area, specifically with regards to new planned housing developments. Their team name is Underground Rising, and we'll hear more from them in a minute, but we have a couple quick introductory slides. On the call today also is our Center Core Director, Rashmi, who is the Associate Director of Science, Policy, and Engagement at the Program for Reproductive Health and the Environment, as well as the Director for the Community Engagement Core, working with me at the Environmental Research and Translation for Health Center. She's a former staff scientist of Earth Justice and toxicologist. Also joining, next slide, please, is our amazing coordinator, Ari. Ari has a role as research coordinator at the Program for Reproductive Health and Environment, and is also a project coordinator for this program, the Reach the Decisionmakers program at the Environmental Research and Translation for Health Center. She's also trained as a full spectrum doula, which is awesome, and is former project coordinator at Code Red Collective. Next slide, please. Your humble host today is me, James Rozier Nolan. I am the Associate Director of Community Engagement at the Environmental Research and Translation for Health Center, or EARTH, and also Associate Director at the Western States Pediatric Environmental Health Specialty Unit, and come from a community engaged participatory research background at Berkeley. Next slide, please. So for those of you who aren't familiar with our Reach the Decisionmakers program, we want to do a quick overview. We just wrapped up our 2024 to 2025 cohort a couple months ago. It was a year-long program. And during this program, we built multidisciplinary scientists, community leader, and health provider teams to promote science-based health standards and public health informed policy in California specifically. This program included both in-person and online trainings throughout the year, as well as mentors for each team and funds for the teams to physically go to Sacramento, meet with those stakeholders, legislators, decision makers, and regulatory professionals, and a modest stipend also for the time of folks to participate. In our cohort that we just wrapped up, we had 19 total fellows, consisting of physicians, nurses, academics, students, and community organizers. And these were broken onto 3 teams. Underground Rising, who's presenting today, we'll be hearing more from them in a moment. Groundwater Protection League, who presented at our last session on improving processes for identifying chemicals and groundwater protection list. And Hear Us, who worked on factoring heat stress into risk assessment for farm worker health, especially in conjunction to pesticide exposures. And each had various outreach endeavors, including to Department of Pesticide Regulation, organizations like OEHA, state legislators, and local communities. And accomplishments, there's many and they continue to roll in. So we're really excited for what's already been done and what's still on the horizon for each of these teams. But each team developed a policy-focused white paper. The teams in total had more than 5 meetings with agency staff at DPR, the Department for Pesticide Regulation, California Water Board, OEHA, and more than 8 meetings with state legislators. And then fellows have mobilized to continue the work far beyond the fellowship. So research is ongoing. Folks have submitted grants and been awarded some of those grants and brought in new members to their team, have hosted comic showcases, as it were, community events, public hearings, and 2 nominations to DPR's EJAC, the Department for Pesticide Regulation's Environmental Justice Advisory Committee. So really, really proud of what's already been done and what's on the horizon. And next slide, please. We're also excited to announce that we were able to obtain funding to continue this program. So we will be recruiting for a 2026 cohort in the not too distant future. We'll open those applications in October, so keep your eyes peeled, and you have all the way up until December 1st to submit them. We'll also have 2 informational sessions during that time frame, and of course be available via email for other additional questions and concerns. It'll be very similar to the last program, really focused on California regulation specifically. Really bringing together multidisciplinary teams, community members, medical providers, researchers. Again, we'll have small stipends for each member of the team, as well as funds and for accommodations and travel to Sacramento. So please stay tuned. One great way to be in the loop is to subscribe to Earth's newsletter. We'll share that link in a little bit. And next slide, please. So today we'll be hearing from Underground Rising, and specifically on their project Protecting Public Health from Rising Coastal Groundwater, Improving Policies to Account for Migrating VOCs in the Richmond area. They worked on scientific and community-based policy recommendations to address contaminated coastal sites at risk of rising sea levels and toxic groundwater intrusion. This project focused partially partially remediated land where new housing is planned, and the project highlighted the potential for newly mobilized volatile organic compounds to enter sewer systems and nearby communities, endangering public health. And their team just had a really awesome blog come out in the Program for Reproductive Health and the Environment's blog series as well. So definitely want to check that out. Next slide, please. This team has all kinds of ongoing efforts. They developed a really amazing comic, and we don't want to steal their thunder, so we won't show it like full screen. I hope they have it in one of their slides. They have, as I mentioned, a recent blog post that just came out, I think a week or two ago. They've got partnerships with one of our environmental scholars, Debbie Adam, who's a UCSF med student, doing research with their team, and also they got a class grant, which is really exciting. And next slide, please. So today's speakers, we'll be hearing from three of that members of that team, Emma Lasky, Kristina Hill, and Rubin. So Emma has an MPH and is a PhD candidate at UC Berkeley and is a researcher, student, and environmental advocate born in the Bay Area. She has worked on ecological restorationist and land manager projects for federal agencies and San Francisco-based nonprofits. Emma received her Master of Public Health from UC Berkeley with a focus on urban heat and equitable access to urban green spaces. She is currently working on her PhD at Berkeley in the Department of Landscape Architecture and Environmental Planning. She studies how contamination along SF Bay shorelines impacts ecological and human health in the context of sea level rise specifically. And as part of the REACH program, she hopes to bridge the gap between scientific research, policymaking, to improve environmental health regulations and protocols related to mitigating exposures to toxins. Dr. Kristina Hill obtained her PhD from Harvard and is associate professor at UC Berkeley. She researches sea level rise and strategies for adaptation to coastal flooding in cities, with an emphasis on the risks and limits imposed by rising groundwater. In this work, she maps groundwater and contaminated sites to identify vulnerable habitat areas, buildings, and infrastructure. And her research teams include people from impacted communities themselves to ensure that the results will be locally relevant. Dr. Hill is the director of the Institute of Urban and Regional Development at UC Berkeley and associate professor of urban design, landscape, architecture, and environmental planning. Her background in geology has given her insights into the way water moves underground and why rising coastal groundwater will shape our adaptation priorities and options. Her work has been featured on PBS, the Hidden Brain podcast, and The Guardian, among many others. And finally, Dr. Rubin is the Director of Science at Breast Cancer Prevention Partners. Dr. Rubin received an MPH in environmental health at UC Berkeley and a PhD in nutritional biology at UC Davis, where she conducted postdoctoral research on epidemiology and exposure science in the School of Public Health. She received a fellowship in reproductive and environmental health at UCSF, where she worked with the US EPA to expand the definition of at-risk populations to include pregnant women. Dr. Rubin's research focuses on the health impacts associated with pre- and perinatal toxic exposures and the prevention of chronic disease during vulnerable life stages. Her article on children's cancer risk from dietary contaminants found that cancer hazards are exceeded for 5 persistent bioaccumulative contaminants commonly found in the food supply. And Dr. Rubin is passionate about translating science for the public and highlighting institutional and individual chronic disease prevention strategies. And without further ado, I'll hand the mic over to the team, and please stick around for Q&A at the end.
Thanks, Emma. So we thought we'd introduce the topic so that, I mean, we're all very content focused rather than describe our process. So that's what we're going to try to do. Next slide, Emma. And one of the things I like to emphasize, and maybe this is because I come from geology, is how long a process this whole sea level rise thing has been. Cities and sewer systems were invented about 6,000 years ago. And over the last 7,000 years, global sea level has risen really slowly. Before that, it rose really quickly, and it's risen a total of more than 400 feet in the last 20,000 years. Now we're facing another period of rapid sea level rise. So we've never actually tried to operate cities during a period of rapid sea level rise, but that's what we're facing now. Next slide, Emma. The state of California has adopted projections from NASA, and we're looking at 2 feet of sea level rise by somewhere between 2065 and 2085. And the way things are going, with the increase in carbon dioxide and methane in the atmosphere and changes in policy that are moving towards a scenario where there probably will be a lot more CO2 and methane in the atmosphere, we're more likely to be on the early side of this range. So more like 2 feet by 2065. This is something a lot of people don't realize. The ocean, this is a USGS diagram. The ocean actually exists under the land. Salt water penetrates under and into the volume of the land. And as the ocean gets thicker, it gets heavier. And that saltwater toe, or the saltwater wedge, it's called in geology, will penetrate farther into the land, pushing the freshwater groundwater up. And I have a cartoon I use for that with public audiences. Next slide, Emma. But the takeaway, I'll show you the cartoon in a second. The takeaway is that groundwater can rise 1-to-1 with sea level, and that over time it's going to get increasingly salty. And that effect can extend 3 or 4 miles inland from today's shoreline with a sea level rise of 3 feet. So it's significant. I use this cartoon to show people the freshwater groundwater in the light blue, the mixing zone in kind of the medium blue, and then the salty groundwater in the dark blue. And this is all going to happen even if we build levees. You'll notice there's a sewer pipe under the street, a dry creek bed, and some pollution that's been capped with concrete. Next slide, Emma. As sea level starts to rise, that sewer pipe will get more water in it, more groundwater from pressure entering separated joints or cracks, corrosion holes in the metal pipes. It'll start to fill dry creek beds, and it will in some areas inundate contaminated soil that's dry today. Next slide. We'll see more and more water in the creeks, more and more inundation of soil, and more filling of sewer pipes before we ever see emergent groundwater at the surface. So most of the damage will already happen before groundwater emerges as flooding. Next slide. Eventually, we will see it in valleys, creek valleys. We will see it in streets. And we already do in the Bay Area start to see at high tides, very high tides, king tides or high astronomical tides, we see groundwater bubbling up through drainage networks that we built to take rainwater away. It's actually bubbling up and causing spot flooding. So we know it's coming. Next slide. This is a little bit more technical diagram that I used in a recent paper to try to explain this. As we pump to try to protect buildings, and this diagram shows a building with its foundations sticking down into the groundwater. It shows the side sewer that supplies the building with sanitary sewer services and a mainline sewer under the street. It also shows contaminated soil on the backside of the building and a dry creek bed. So as people adapt to changing conditions, they're going to pump, and that pumping is going to change the position of the saltwater boundary much more than even sea level rise will. There's about a 1-to-40 ratio. So if you pump the freshwater down a foot, you bring up the saltwater boundary by about 40 feet. So that's going to cause salty conditions to move up in the water table underground. Next slide, Emma. As sea level rises, you can see in this diagram, the building has started pumping. Those short, thick black lines around the building represent pumps. Next slide. And those pumps bring the salt water, which is shown in the light purple, up into the zone around the building. So now the building foundations sit in salt water, which they probably were not designed for. The collapse of a condominium building in Florida a few years ago is an example of the terrifying structural damage that can occur because foundations are sitting in salt water. So there's a life safety risk, as well as a risk that pumping will actually begin to pull contaminants towards the building and towards its sewer pipes. That's what you see with the red arrow. The pumping at the building is actually pulling contaminated groundwater towards the building. Next slide. So we made maps of where the contaminated sites are around the Bay Area, and we found more than 1,400 contaminated sites that are currently known to contain contaminants. These aren't closed treated sites. These are sites that are in some partial condition, either not fully treated or only under investigation still. And there are many of them shown in the black dots for these 4 kind of zoomed in areas of the Bay Area. The yellow represents inundated areas with 3 feet of sea level rise, and the light blue represents areas where groundwater is shallow and predicted to rise. So there are 1,480 sites over the areas where groundwater is shallow and predicted to rise, or inundation would occur by groundwater. Next slide. In Denmark in 2010, they did a very detailed study showing that a plume shown here in the yellow of TCE actually contaminated sewer pipes. So the red line shows the sewer pipe, and the measurements are of air and water concentrations of chlorinated VOCs in the sewer pipe. And then they measured inside houses that were attached to the sewer pipe, and they found contamination by VOCs of indoor air in the kitchen and in the bathrooms primarily. So this was a very detailed study. We haven't seen many this detailed in the United States yet, but we should. Next slide. Sorry, this is a little offset. This is a contaminated site in Richmond that our community partners care a lot about. It's called Campus Bay, but it includes the Zeneca chemical factory site. Stauffer Chemicals was the original name. There's a cornucopia of contaminants here because it was a chemical factory. And then adjacent to that, where the eucalyptus trees are, is the University of California, Berkeley's site called the Richmond Field Station, where students and faculty and researchers occupy the buildings and are present on the site a lot. Next slide. This map shows that same site where these skinny black lines are, and each black line is a flow line, a potential flow line of VOCs. They start at a monitoring well where VOCs have been detected, and then they flow downhill on the surface of the water table. And you can see in the red circle that the skinny black lines cross a lot of sewer lines, which are shown in brown. So there's a lot of potential for moving contaminants to intersect with sewer lines. Next slide. Sewer lines corrode because of biological activity inside the pipe, where hydrogen sulfide is generated by decomposing waste, and because of saline groundwater on the outside of the pipe. A lot of pipes, metal pipes and concrete pipes in the Bay Area are corroded or have separated at the joints because of seismic activity. Next slide. So if VOCs enter a sewer pipe, or even the backfill around the sewer pipe, they can travel pretty far. A study in 2020 showed they could travel more than 2,000 feet downhill in a sewer pipe and about 750 feet uphill. And most people don't realize that VOCs can travel uphill. So communities that live around contaminated sites, if they live uphill, they may not realize that they're at risk. Next slide. We are starting to map as a kind of screening tool, trying to show the state water board and DTSC how to do this. We've developed a screening method where we look at the site of origin of the contaminants, we look at the flow lines that contaminants could move in on the water table. And then we draw kind of whiskers out from there of the sewer lines and show what buildings are attached to those sewer lines. This is Emma Lasky's mapping work. We identified for only 21 sites in EJ neighborhoods around the Bay Area, we identified 22 schools attached to those sewer pipes within the distance that the VOCs could travel, and hundreds of residential buildings. Next slide. So Emma's going to talk more about what she learned by looking at a particular set of sewer pipes around the Zeneca site in Richmond. But I just wanted to emphasize this is a big problem, and the scale of movement of contaminants is somewhat unpredictable because pumping as an adaptation to sea level rise could happen on private properties that the public has no idea about. To protect larger buildings or expensive properties, and less managed buildings are likely to have problems keeping out gases from these sewer lines. I'll let Emma talk about what she found in her fieldwork. Thanks, Emma.
Thanks, Kristina. All right, so yeah, I'm going to be talking about the methods used to identify buildings that are potentially at risk of vapor intrusion in contaminated landscapes, specifically in the Richmond area. And this work was completed through funding from the California Breast Cancer Research Program, CLASP, like James had said earlier. And also we did this in collaboration with the Richmond Shoreline Alliance, the UCSF Earth Center, and then UC Berkeley's Office of Environment, Health, and Safety. So as seen in Professor Hill's presentation, groundwater rise may impact the movement of contaminants away from their original location and into nearby sewer systems and buildings. So in this figure, you can see for label 1, it's showing a cracked sewer pipe that's being infiltrated by that magenta colored VOC, which may be then volatilize and then be detectable in the cleanout, which you can see indicated as 2. So finding a gaseous form of VOCs in sewer systems in these contaminated areas may imply that there is this unanticipated pathway for contamination to enter buildings and expose individuals. So to investigate this potential phenomenon, we wanted to conduct this air sampling study to understand if these VOCs can travel through sewer systems in these contaminated coastal landscapes. And we also wanted to try and observe if there's an effect that seasonality may have on contaminant concentrations in the sewers. So for this pilot study, we were focusing on the Richmond Field Station, which you can see as that red star, and that's located along the Richmond shoreline in Contra Costa County. The Richmond Field Station is owned and managed by UC Berkeley, so it made it logistically simple as our pilot study. And as Professor Hill had shown us in the figure earlier and described, there's numerous open and closed contaminated sites. So you can see all those black dots are the open sites, and then the smaller outline dots are closed sites. And you can see those within and around the RFS, or Richmond Field Station. And this is an aerial image from 1949 of the RFS and the nearby chemical manufacturing plant that Kristina was mentioning earlier. So historically, the RFS and this site participated in industrial activities, creating this very contaminated landscape that is called Campus Bay now. And this is just showing an overlaying of a report done by a private company showing the TCE concentrations in the groundwater and the potential plumes that could be created adjacent to the Richmond Field Station, as well as in the Richmond Field Station. And the colors don't quite matter as much as just the location, but this sort of led us to hypothesize that we could find these gaseous versions of the compounds in the cleanouts that are sampled nearby the plumes. So in this study, we were installing these passive air sampling devices into 9 cleanouts attached to buildings with sewer lines that were intersecting the suspected contaminant plumes. And the buildings sampled can be seen here in blue. with the city and UC-owned sewers shown in orange and green. And then I also added this original parcel boundary for the site adjacent to the Richmond Field Station, just to orient us on the overlap of sewer systems and the contaminated landscape. And then on the right here, you can see the passive air sampler that I installed. And the way I installed it was I fastened it to a clean out plug. And then I replaced that original plug, which is the yellow one you can see there, with the new one. And then I was able to measure specifically for TCE and PCE, which we were interested in because of the plumes that were found for both of those contaminants in the area. So to investigate our question on seasonality and if it's having a potential effect, we sampled during 3 separate periods for the duration of 2 weeks each. The samplers were installed once in the dry season in October and then twice in the wet season in January and February. And we gathered precipitation and tidal data for all 3 periods. And we noticed a small difference in the tidal maximum in feet between the dry and wet periods, but we noticed a pretty significant difference between the wet and dry periods with the 4-week prior inclusion. So the cumulative precipitation over 4 weeks prior to the sampling period, we saw this difference. And we expected to see that difference also in the depth to groundwater at the Richmond Field Station, which we did see. So we could see here in the wet season, it was noticeably shallower than in the dry season, just helping reinforce that idea that groundwater is moving and rising when there's these events happening like atmospheric rivers. So these are results for the TCE vapor concentrations in the 4 specific building cleanouts at the Richmond Field Station. So each box is a separate graph that represents the building cleanouts. And then the green is for the dry season, whereas the orange is for the wet season. And you can see that the cleanouts for buildings 163, 400, and 454 seem to have a pattern, which is showing that in the dry season, there's virtually nothing seen in terms of the concentration of TCE. Some were non-detects, whereas in the wet season, it appears that there's this pattern of there being some meaningful data that we collected showing that there are higher concentrations. That said, we did see the reverse pattern showing for 472. So that's something that we're still trying to work through and talking to other people about, trying to understand why that might be happening. And we found similar data or patterns, I should say, for PCE. So we were seeing the same thing where it seemed that there were non-detects in the dry season, whereas we saw more higher concentrations of PCE in the wet season. And then we saw that same reverse pattern happening here. So it just shows that there's sort of a complexity occurring that we need to understand and investigate a little more closely. So overall, we found these concentrations of TCE and PCE to be higher in the wet season, specifically for 3 buildings, the cleanouts of 3 buildings being 400, 454, and 163. And then we observed that opposite pattern for 472. And it's just an interesting thing that we need to poke around and figure out more of. But yeah, that's all just to say that there's greater need for conceptual models to understand the seasonal influence. VOC monitoring in the sewer systems with continuous data loggers would give us a bit more of a precise and higher temporal resolution to understand how seasonality might be having effect. And then also we need more fence line monitoring for these of sewer systems at these contaminated sites, just to get a better idea of how things might be moving underground. Now I'll pass it off to Rainbow to talk about the health risks of VOC inhalation. Rainbow, can you?
Thanks, Emma. Sorry,
Yeah,
please.
yeah.
So research shows that VOC exposure has a number of health effects. Summarized here, we see that many VOCs of concern are classified either as known or probable carcinogens. Some of the documented health effects of VOC exposure include liver and kidney impacts, increased cancer mortality, genotoxicity, leukemia, bladder and breast cancer, lymphoma, and myeloma. Slide, please. These are examples of some plastic compounds that are made using VOCs. Question, do these chasing arrow symbols mean that a plastic is recyclable? Anyone? 50-50.
No.
That's right. No, it does not. So vinyl chloride and ethylene dichloride are used to make polyvinyl chloride, or PVC plastic number 3, a non-recyclable plastic and the fastest growing plastic being produced today. Side note, plastic production is expected to increase exponentially in coming years because the fossil fuel industry is pivoting from fuel to plastic production. And then there's polystyrene, which is manufactured using benzene. More than half of benzene is processed into ethyl benzene, which is used to make polymers like polystyrene, another unrecyclable plastic. So compared to traffic-related VOCs, we know much less about the extent of health impacts from these types of hazardous air pollutants or toxic air contaminants, defined as chemicals that increase mortality or death from cancer, reproductive health effects, or other serious health effects. Slide, please. And when we think about vulnerable populations, we know that the sensitive systems of developing children are vulnerable to impacts of VOCs because of their higher breathing rates, higher lung surface to body weight ratios, and immature respiratory and immune systems, with documented associations between childhood leukemia and VOC exposure. We also know that communities of color experience a much higher cumulative burden of chemical exposure, but we have less data on the health impacts from these exposures. Slide, please. We also know that chronically inhaling low concentrations of VOCs can lead to increased risk of cancer later in life due to the long latency period of VOCs illustrated here. Many of the health effects reported about VOCs, particularly benzene, were only detected if a study period of 20 to 30 years was considered. Slide, please. Which brings us to the UCLA to air toxic study, an important recent study addressing the gap in understanding of air toxics and breast cancer specifically. Making use of the multi-ethnic cohort with over 48,000 participants, researchers tracked breast cancer occurrence from 1993 to 2013, associated with air pollution data from the National Scale Air Toxics Assessment from 1998 to 2003. And here you can see on the map the race and ethnic distribution of study participants, with African Americans in red, Japanese Americans in blue, Latinx participants in orange, and white participants in green. Slide, please. Researchers chose 16 hazardous chemicals that act as endocrine disruptors or mammary gland carcinogens. Here with the top group from traffic-related sources and hazardous waste and industrial sources on the bottom. This is an important study because it had a large, diverse study population, over 48,000, and had a long study period of 20 years, which is important to capture the latency period of VOCs. Slide, please. Researchers examined associations between exposure to VOCs and breast cancer coming from both traffic-related sources on the top and the industrial ambient sources on the bottom. And this graph shows the adjusted hazard ratios associated with each interquartile increase of exposure. And results showed that the greatest increases in breast cancer risk came from vinyl compounds, such as vinyl chloride, ethylene dichloride, and vinyl acetate, and with between a 2 to 5 times higher risk of getting breast cancer among those exposed to higher levels compared to those exposed to lower levels. Of 16 hazardous chemical studies, 14 significantly increased likelihood for getting breast cancer. Slide, please. And when we break it down by race ethnicity, we find those hazards were greatest for women of color. For vinyl acetate, whereas the average population experienced about a 5 times higher hazard from higher exposure, African American women had more than 11 times the breast cancer hazard. Slide, please. Taking a closer look at these specific chemical levels, here are average chemical concentrations in the census tract of the study participants in micrograms per cubic meter on the x-axis. Traffic-related pollutants were highest in exposure level concentration, but a key finding of this study is that though exposure was lower for the non-traffic related pollutants, it was these that resulted in the highest breast cancer risks. Slide, please. And here's a side-by-side of chemical concentrations on the left and breast cancer hazard ratios on the right. This is busy, but illustrative of the how the lowest exposure levels were associated with the highest hazards for breast cancer. Not only that, the exposure levels are in quite a tight range, but the risks vary widely. This finding highlights the need to evaluate health effects from multiple chemicals due to their ability to disrupt the endocrine system and induce carcinogenicity, even at low levels. And shown here are the cancer risk values we generated comparing exposure levels to DTSC human health screening levels. These regional screening levels are set to protect populations, including children, based on a target risk of 1 in 1 million, and aim to reduce and address cumulative risk. And we can see that the increased cancer risk at these study concentrations is captured by 5 of those levels, but not all of the screening levels, with average benzene concentrations at about 5 times higher than the screening levels. Slide, please. When we look at where these chemicals are coming from, there isn't always a clear answer. Take, for example, vinyl acetate, which was associated with the greatest increases in breast cancer risk. Only 2 facilities reported vinyl acetate emissions during the study period. You can see the 2 little red dots on that gray map, indicating that emissions may have come from landfills or hazardous waste sites. Slide, please. And we can see that likelihood with the broad swath of low and mid-level concentrations of vinyl acetate across the region, perhaps coming from those waste facilities or vapor intrusion.
Maybe I can share that cartoon that
Yeah.
was at the beginning, just so you can see what it is we were working community partners. Is that showing up, the first part?
Mm-hmm.
And we've gotten a lot of feedback on this. We've translated into Spanish, and we've gotten some feedback about what makes sense and doesn't make sense to folks. So we're going to revise it one more time. And that's the last frame. Great.
Yeah, excellent work. Thank you so much.
Thank you, and thanks for having us participate in the REACH program. We learned a lot.
Thanks so much, all. Thanks for the great presentation and for the whole last year, and we're looking forward to staying in touch with you.
Thank you.
Thank you.
Bye-bye.